두 가지 기준 뭐였죠?
Depth of the layer and fiber direction. So before starting, I remind I have to be aware for two informations. Depth layer, and it's okay to start every time in the first layer I know trapezius. Then I remember second layer, this was splenius we performed before, and now we go to the third and the fourth layer, and I know I will not can palpate this muscle directly. I have to know where the leg can make a provocation, but I can't feel the muscle itself.
그래서 우리가 항상 이제 첫 번째 층에서는 이제 어퍼트랩이 있는 걸 알 수가 있습니다. 두 번째는 스플레니우스가 있는 걸 알 수 있고, 지금부터는 세 번째, 네 번째를 찾아가는 과정을 가질 건데, 이제 항상 바로 이렇게 만지는 것보다는 아까 말했던 기준점 두 개를 이용해 가지고.
And the fiber direction I know splenius capitis, splenius cervicis, multifidi, rotatores. This I visualize. Then I know I can take here the whole package. So with this whole package, I have three layers. I have all muscles without the fourth level. So I know I have the trapezius, I have the splenius, but primordially I have the semispinalis, capitis and cervicis when I take it like this. Hold the package, both sides, or I can take just one side. I go between the spinous transversus and the transverse process. Spinous. It's very difficult because I speak this Latin terminology.
TP나 SP를 좀 찾는
Processus spinosus, processus transversus. It's because it changed. It's no problem. Spinous process, yes, spinous process and transverse process. And in between, you take all the package as profound as you can. You go like this, like a lion. Then you okay. And this you make in different positions. You are looking what can you take like this. Okay, this is the focus of the semispinalis tract. One side or both sides. If you feel it doesn't work, sometimes you have to move ahead a little bit in this position, then it's more released, but you have less space. And if you have too little space, you move a little bit like this. You have more space, but it's more tensed, and you have to find the optimal position. You have to change a little bit. Okay. Now, if you find hot spots, you can't palpate the muscle, the taut band again. It's a provocation procedure here too. If you find hot spots, you can provocate it, and you can treat it if you have pain recognition with or without referred pain. Does it hurt? It hurts. Local or
local?
Local. Do you know it?
No.
No. So it's no trigger point. Okay. But the treatment would be like this or like this. And now you don't know is it first or second or third level. You provoke all three levels, then you can go again. The first level muscle you can reach like this. Does it hurt equal as before? Equal. So you know it was a problem in the trapezius. But if it's different, it hurts like this, but it's not the pain the patient is familiar with. You go again, and now he says, oh, this pain I'm familiar with, then you know it's the third level. Like this you can differentiate. Okay. Now for the fourth level, there are two approaches. One approach is I'm between C7 and C2. One is you take here this third level muscles, semispinalis, and you go dorsal of the transverse process, but ventral from the semispinalis muscle. Then you reach the dorsal part of the laminae. Okay, and there lies the rotator muscles. Okay, so the lateral part of the rotators you can reach more or less directly if you are anterior of the third level muscles of the semispinalis. You got it?
자, 일단은 맨
You continue,
처음에
I hope.
일단은 먼저 세 번째 층 만지는 것부터 했습니다. 그렇죠? 그때 이제 전체적으로 이렇게 확 이런 그립으로 전체 근육 첫 번째, 두 번째, 세 번째 층을 다 잡을 수는 있습니다. 그래서 여기서 자극을 주는데 만약에 아프다. 근데 제가 이게 뭐 첫 번째 층에 있는 근육이 아픈 건지 두 번째 층에 있는 근육이 아픈 건지 뭐 세 번째 층인지 모르니까 일단 여기서 한번 이제 문진을 하고 같은 현상이 일어나는지 첫 번째 층 근육만 분리를 해서 만져보고 또 같은 질문을 하는 겁니다. 그렇게 감별을 할 수가 있고 머리의 익스텐션, 플렉션, 포지션에 대해서는 그냥 자기가 편한 거 찾으면 된다고 합니다. 왜냐면은 지금은 공간이 좁아서 못 만질 수도 있지만은 펴면은 텐션이 너무 생겨서 못 만질 수도 있으니까 요거의 기준은 이제 사람에 따라서 다르게 할 수가 있습니다. 그다음에 네 번째 같은 경우에는 이제 로테이터를 찾아가는 게 네 번째 층이죠. 그래서 아까 세미 스파이널리스 머리 방가식을 만질 때처럼 찾은 다음에 트랜스버스 프로세스를 찾고 여기서 뒤쪽으로 가기는 합니다만은 어디까지 가느냐면은 이제 라미나까지 이 그 가시돌기 스파인 나도 못하게 가시돌기 사이에 네 가시돌기에 있는 사이까지.
Okay. A little model. This would be the straight system, third layer muscle, semispinalis capitis and cervicis. Okay. Third level. Above would be splenius and trapezius. If now I take these muscles and because it's long, I can move it from side to side. And if I now take this muscle and I go anteriorly of this muscle and dorsal of the transverse process, then I'm here dorsal of the laminae. And here lies the rotator muscles. So you can reach by performing such an access, you keep in the hand the semispinalis, what you can move, and you go anterior of the semispinalis and dorsal of the transverse processus, then you reach the lateral part of the rotator muscles, of the fourth layer muscle.
그러니까 이게 이렇게 있잖아요. 그래서 일단 만질 수 있고 그 다음에 엔테리어 파트 쪽으로 조금 가면 로테이트 머슬들을 만질 수 있다.
And the rotator and multifidi, they are fixed because they are short. They have to rest here. I can't move them away.
그래서 추가 설명을 드리자면은 그 방가식은 같은 경우에는 이렇게 잡고 움직일 수는 있습니다. 그래서 움직여 놓고 한 손으로 고정을 시킨 다음에 그 밑으로 해서 이제 트랜스퍼스 프로세스부터 해서 로테이터들을 확장을 하면 된다는 거죠.
The treatment is very simple. I have just to take all what I can. I go ventral from this structure. You see, this what moves is first, second, and third level, and I'm deeper than the third level, so I'm on the first level, and I feel here the transverse processes. I go dorsal from the transverse processes, but ventral from the semispinalis, and so I'm on the lateral part of the multifidi and rotators. Perfect. And it's very different how deep you reach here. It's sometimes you can't reach, and sometimes you can touch the spinous transverse, the spinous process. Thank you. Okay. It's okay? So this is a technique 4 between the third and the fourth layer, between semispinalis and rotators. And then I press ventrally to provoke the rotator. And you see the strong irritation. It's okay? It's okay? It's too much? Do you know this pain?
Yes.
You know it.
Yes.
Oh, great. For the therapy. So this would be a movement. Technique 2A. Okay. This is for the lateral part of the multifidi and rotators. Most often you can't reach the spinal process. Most often you have to treat like this. Here we have C2, C7. I go between C2 and C7, not on the spinal process, a little bit laterally. I'm here exactly. I show it here. I'm between C2 and C7. I go here in this area, close to the spinos.
SP.
SP, yeah. Spinos process.
Yeah.
You are better with these abbreviations. I learned from you. This is great. SP. Okay.
SP.
Yeah, you can say like SP or TP. So okay for
It's
us.
good. For me, it's also easier. I didn't
Yeah.
know. Super. So, a little bit lateral from SP, you go here deep through all layers of the muscles. It's okay? Does it hurt?
No.
No? Here? It hurts?
More.
It hurts? Yes or no?
Yes.
Yes. Okay. And now I don't know why it hurts. I make a very big provocation for many, many structures. I have to know. I have the pressure, but I have also a little movement. And it could be that it is a joint problem because of the movement. So I have to differentiate it. To differentiate, is it a problem for reason of pressure or for the reason of the movement?
이게 이제 지금 누르고 있는 상태에서는 이게 모든 층을 이렇게 눌렀고 그렇기 때문에 내가 어떤 구조물 때문에 이렇게 아파하는지를 알 수가 없습니다. 그래서 이게 뭐 내 프레셔에 대한 건지 움직임에 대한 건지 알 수가 없기 때문에 그 공부를 하기 위해서는 우리가 또 움직여 보는 것도 필요하다는 거죠.
Okay, if we reach to reproduce the pain familiar for the patient, you know this pain?
No.
No, but it's pain, huh?
Yeah.
Okay. Then you go and you take your hand and you make a mobilization in the same direction, in the same movement, and you ask, does it hurt again?
No.
No. Now I know it's not the movement the cause of the pain, huh? But you have to differentiate first. And if this movement would be painful, then I think it's a joint problem. Then I have to follow this path. But if the movement does not hurt, it's not a joint problem. Then I rest on the myofascial hypothesis. Okay. And then I press again. You feel the pain again?
Yes.
Yes. Okay. Then I don't know about the layer. I press the first, second, third, and fourth layer. I don't know where is the problem. So now I can take all the muscles of the first, second, and third layer, and I make a provocation like this. And now I make provocation for all muscles without the fourth layer. So I ask, is the same pain as before?
Yes.
It's the same pain now. Now I know it's not a problem in the fourth layer. It must be a problem in the first, second, or third layer. And so I can differentiate without direct palpation, but I can get the information.
일단은 첫 번째로 한 거는 관절 모빌라이제이션을 통해 가지고 이게 관절 때문인지 내 프레셔 때문인지 감별을 하는 과정을 거쳤고요. 거기서는 이제 동현 선생님은 안 아프다고 했습니다. 이런 경우에는 우리가 이제 근육 쪽, 근막 쪽으로 이제 접근을 계속 유지하면 되는 거고, 이렇게 했을 때도 아프다고 하면은 이제 관절 쪽으로 접근하면 되고, 그 다음으로 구분해야 될 거는 내가 지금 전체 층을 다 누르고 있기 때문에 이게 몇 번째 층인지는 정확하게 알 수가 없을 때는 우리 3번 했을 때처럼 전체 근육에 다 프로복 자극을 하고 다시 문진을 해서 같은 반응이 나오면은 이거는 내가 뭐 4번이나 3번 이런 쪽이 아니구나, 전체일 수도, 그 위층일 수도 있구나 생각하면 되고, 아니면은 내가 깊이 눌러야만 이 사람이 자극을 받는구나라고 생각하면 됩니다.
So please perform three things. First, we reach the semispinalis, like this, or like this, one side or both sides together. First. Second, you reach fourth layer muscles from lateral. You are profound, deeper than the third level and dorsal of the TP.
Yeah, that's right.
Extra. Okay. And third, you go a little bit lateral of the SP and you go here profound, and then you make the differentiation. Is it the movement which hurts, or is it the pressure which hurts? Yeah.
연습은 세 가지 단계로 하시면 됩니다. 첫 번째 연습 단계는 이런 식으로 한쪽 혹은 양쪽 다 해서 반가시근을 먼저 이렇게 팔페이션을 하고요. 두 번째는 여기서 이제 가로 돌기 뒤쪽으로 시작을 해가지고 네 번째쯤 로테이터를 찾는 거. 그다음에 세 번째는 전체 SP 쪽을 누르고 그다음에 통증이 많이 유발되거나 하면은 각 레벨마다 조인트 모빌라이제이션을 통해서 구분을 하는 거. 그렇게 세 가지 스텝 해가지고 연습하겠습니다. We go start right
Perfect.
now.
Yes.